Hello and welcome to Cirrhosis of the Liver. On a side note, my Zoom did not have a record button, so I had to try another app. What is cirrhosis of the liver? Cirrhosis is a chronic degenerative disease in which normal liver cells are damaged and then are replaced by scar tissue. Etiology. Causes and symptoms. Long-term alcoholism is the primary cause of cirrhosis in the United States. Chronic liver infections, such as hepatitis B and particularly hepatitis C, are commonly linked to cirrhosis. Liver injury, reactions to prescription drugs, medications, exposure to toxic substances, and repeated episodes of heart failure with liver congestion can cause cirrhosis. Obesity has recently been recognized as a risk factor in non-alcoholic hepatitis and cirrhosis. Poor nutrition increases a person's risk of developing cirrhosis. The disorder can also be a result of diseases that run in families, inherited diseases, like cystic fibrosis, a lack of specific liver enzyme, the absence of a milk-digesting enzyme, aka galactosemia, an inability to convert sugars to energy, glycogen storage disease, a disorder characterized by accumulations of copper in the liver, brain, kidneys, and corneas, Wilson's disease, and several others. Types of cirrhosis. Portal or nutritional cirrhosis is the form of disease most common in the United States. About 30 to 50% of all cases of cirrhosis are this type. 9 out of 10 people who have nutritional cirrhosis have a history of alcoholism. Biliary cirrhosis is caused by intrahepatic bile duct diseases that impede bile flow. Bile is formed in the liver and is carried by ducts to the intestines. Bile then helps digest fats in the intestines. Biliary cirrhosis can scar or block these ducts. It represents 15 to 20% of all cirrhosis. Various types of chronic hepatitis can cause post-necrotic cirrhosis. This form of the disease affects up to 40% of all patients who have cirrhosis. Disorders like the inability to metabolize iron and similar disorders may cause pigment cirrhosis, which accounts for 5 to 10% of all instances in the disease. Demographics. Cirrhosis is twice as likely to occur in men than women. Here is a table with different countries on the left and the proportion of deaths in female and males and what the cause of the cirrhosis was from hep B, C, alcohol-related, etc. And then on this graph, it is per 100,000 population of compensated cirrhosis, both sexes combined, and the different colors represents different numbers. The red and oranges are the higher numbers, particularly in Mexico, Russia, some of Africa, and the Middle East. Those numbers are not good. Cirrhosis changes the structure of the liver and blood vessels that nourish it. The disease reduces the liver's ability to manufacture proteins and process hormones, nutrients, medications, and poisons. Cirrhosis gets worse over time and can become potentially life-threatening. Here's the anatomy of a liver. It's part of the digestive system. Your main arteries, blood supply, duct, gallbladder. And here's a very intriguing picture of a healthy liver and a not so healthy liver. Let's see if I can move my picture out of the way. Okay. Symptoms of cirrhosis are usually caused by the loss of functioning liver cells or organ swelling due to scarring, The liver enlarges during the early stages of illness. The palms of the hands turn red, and patients may experience constipation, diarrhea, abdominal pain, fatigue, indigestion, loss of appetite, nausea, vomiting, weakness, weight loss. As the disease progresses, the spleen enlarges and fluid collects in the abdomen. It's called ascites, and legs edema. If you've ever seen someone have ascites drained from them, patients come in with large abdomen and they lose 20 pounds at a time and fill liters up, and the fluid is yellowish brown. And then the CT techs will name them different beers because they're bored sitting there waiting for the liquid to drain. Mortality rate. CDC rates per 100,000 population. There are 13.1 deaths in 2017. And Medscape states that cirrhosis of the liver is the ninth disease-causing death agent in the U.S., responsible for 1.2% of all U.S. deaths in 2020. Diagnosis. A doctor who suspects cirrhosis may order blood tests and urine tests to measure liver function. CTs, ultrasounds, and other imagings can be used to help determine the size of the liver and indicate whether it's healthy or scarred. A liver biopsy is usually needed to confirm diagnosis. In this procedure, they get a tissue sample with a needle and examine it under a microscope. Those aren't very fun. Treatment for cirrhosis. The goal of treatment is to cure or reduce the condition causing cirrhosis, prevent or delay disease progression, and prevent or treat complications. Liver transplants can benefit patients with advanced cirrhosis. Treating underlying disease. There are some homeopathic and alternative treatments for cirrhosis. There are several herbs such as dandelion, rock poppy. They are in some teas, especially at Sprouts, and they may help improve the efficiency of liver cells. Cirrhosis-related liver damage cannot be reversed, but further damage can be prevented by patients who eat properly, get enough rest, do not consume alcohol, and remain free of infection. The end. Thank you for watching my presentation.